Breaking news! There is a worrying number of cases happening here in UiTM Bertam due to preparation of sports festival. Students are experiencing
muscle pain and joint ache.
Good afternoon and salam from the community of pharmacy. Just now, we were alerted on the issue that is going around UiTM campus Bertang. Many students are experiencing muscle and joint pains, including inflammations. It was reported that these students are involved with the preparation of a sports event coming next July. The community of pharmacy has decided to take actions by establishing a new program called Sahabat Ubat. This way, students can identify and get to know more about over-the-counter medications that they can get from the pharmacy. Not to forget, we also prepared the introduction of two of our closest friends, Capsaicin and Topical Diclofenac, and two doctors for the unit Kesehatan.
Hi everyone, I'm Capsaicin. You know that spicy taste found in chili peppers? That's all because of me. However, I also use in pharmaceutical treatment. I can be used to relieve pain like neuralgia, which is nerve pain, minor pain associated with rheumatoid arthritis and muscle sprain. I am classified as a transient receptor potential vanillite 1 receptor agonist, meaning I can bind to and activate TRPV1 ion channel. The RBV1 is often referred to as Capsaicin receptor and normally detects scalding heat and noxious chemical. Now, shall we move on to mechanism of action? First, I activate the TRPV1 receptor on pain nerve fibers that allow for an initial release, then decrease of substance P. You might be wondering what substance P is. Well, it is a neuropeptide that transmits pain signal, which means a decrease of substance P will result in reduced pain signal transmission over time. What do you think my therapeutic indications are? You might have remembered that I am used as an analgesic. I can help relieve nerve pain, such as minor pain related with rheumatoid arthritis, and soothe muscle pains too. Now, it's time to talk about pharmacokinetics. Remember the abbreviation of ADME? So, for A stands for absorption. I can be taken orally. However, topical administration is far more common. Of course, that's because I get absorbed more robustly into the skin compared to the digestive system. For the distribution, I'm highly lipid soluble, which means I can easily cross the cell membrane and be distributed widely into various tissues in your body. So M stands for metabolism. My metabolites are named vanillamine and vanillic acid. They metabolize primarily in the liver and intestine by the cytochrome P450 enzyme system. Once I have done my job, I get secreted out almost entirely through the urine.
Hi everyone! I'm Topical Diclofenac. I'm a gel used to treat pain and other symptoms of arthritis of the joints, which is osteoarthritis. These symptoms include inflammation, swelling, stiffness, and joint pain. I'm what is known as a non-steroidal anti-inflammatory drug, or also known as NSAIDs. I also provide analgesic and antipyretic effects. Now, I'll move on to my mechanisms of action. Would you like to know how I decrease inflammation? First of all, I inhibit two enzymes, which are cyclooxygenase 1 and cyclooxygenase 2. What are those enzymes responsible for, you may ask? Well, COX-1 is an enzyme that is responsible in converting arachidonic acid into prostaglandin precursors. Arachidonic acid is released by cell membrane during injury or inflammation. COX is basically used to protect the stomach lining. While COX-2 is an inducible enzyme that rises during inflammation and contributes to prostaglandin-mediated pain and swelling. I also inhibit prostacyclins and thromboxanes, which are lipid mediators derived from arachidonic acid. Types of prostaglandins are less precursors are produced. Less prostaglandins means less pain sensitization, less swelling, and less redness. Finally, less local inflammation. Now, would you like to know my therapeutic indications? Well, I'm indicated for treatment of acute and chronic pain with inflammatory conditions, especially those involving the musculoskeletal system. For example, osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. Don't forget, I'm also useful in managing post-operative pain and actinic keratosis. Okay, now let's move on to my pharmacokinetics. Remember, A, D, and E. A stands for absorption. When I am applied on the skin, I am well absorbed into the subcutaneous layers of the skin. Then, D, distribution. Although my bioavailability is lower than oral and intravenous administration, but overall, diclofenac binds 99.7% to plasma proteins and mainly binds 99.5% to albumin. Next, M, metabolism. The main metabolites that I produce is 4-hydroxydiclofenac, which is about 30 to 40%. I go through glucuronidation of the intact molecule and few of hydroxylations process. Next, E, eliminations. I have a half-life of about 1 to 2 hours. Me and my metabolites are excreted mainly in the urine, and that's about 60%. The remaining, about 40% is eliminated as metabolites by bile and feces. Well, that's all from me. Topical Diclofenac saying bye-bye!
Assalamualaikum and hello to all. I'm your broadcaster today, Shamsa Shara, and I'm here at Unit Kesehatan of your ITM, Penang Campus Pertama, and I'll be here to be interviewing two doctors from the unit itself about the medication that is used that are given out to students who are experiencing joint pain and inflammation. Today, I'll be interviewing two doctors from the unit. This is Dr. Anis, and this is Dr. Farah. Today, I'll be interviewing Dr. Alice first. Hello, doctor. Hi. For today, can I ask you about the medication that you give out to students? Alright, so I was talking about topical diclofenac. This medication is applied directly to the skin to help relieve pain and inflammation. And also it is commonly used for conditions such as osteoarthritis, muscle pain, and also joint pain. And as for the dosage and administration, also for the duration of the therapy, can you tell us more about it? For the duration, for patient that having this kind of condition, we suggest to apply 1% concentration of topical diclofenac and be applied on the knee, ankle, elbow, or their shoulder. And also they should apply for few days, especially for acute sprains and several months for chronic skin condition. And then I've heard about the side effects to the students while interviewing them ago. Can you tell us more about the side effects? So for the side effect, they might face localized skin condition after the application. Can you tell us about the contraindication? Maybe some students you cannot give out to them. So the contraindication is that patient who is allergic for aspirin and also NSAID. And can you tell us maybe there is an interaction with the drug or another food? Can you like elaborate more? So for now, there is no drug interaction or drug food interaction regarding this topical diclofenac. What about how do you advise the students or other patients on how to store this medication? So for the storage and handling, they need to have a preparation before applying the gel, which is they must make sure their skin is clean and dry and not to be applied on infected or irritated skin. And also they must be remembered to wash their hands before applying the gel and avoid contact with their eyes, nose, and mouth. Oh, last question. What about the precautions? Maybe there is a student that doesn't use the precaution and then it affects them badly. Maybe. If patient fix that problem, they need to seek medical attention immediately as soon as possible. Oh, that's all. Yeah, thank you, doctor. Thank you. Alright, we'll go next to Dr. Farah. Moving to another doctor in charge, Dr. Farah. Doctor, can you tell us
about another medication that can be used for joint pain and inflammation?
Absolutely. The second medication that we can give out in this situation is a topical medication containing capsaicin, which is available in patches, creams, gels, lotions, and solutions.
Oh, is that so? Can you tell us about how this medication can be used?
Of course, capsaicin is a topical medication, which is a topical analgesic for various painful conditions. For example, musculoskeletal pain, which is arthritis and joint pain. Patients are advised to apply this medication about 2 to 4 times daily to the affected area, namely the joints. Of course, do take note that it requires about 2 to 4 weeks of consistent and consecutive use for it to actually give a full benefit.
Can you tell us about the side effects of this medication to the patient?
Oh, of course. So it's normal for capsaicin. It's normal to feel a hot stinging sensation because it's derived from chili peppers. Of course, that's what gives it the hot feeling. Especially during the first 2 weeks of use, this sensation will stop if you use it continuously, though. So it's important for patients to not stop the treatment prematurely.
Oh, and then, is it safe for anyone to use it, or is there any precautions to anyone, like maybe allergies or something like that?
Oh, of course. Well, anyone with hypersensitivity to capsaicin and chili peppers in general should just avoid using it, of course. But it's also a good idea to wash your hands after using it, and of course, make sure not to touch your eyes or any mucous membranes, because that will be really painful. Uh, Remember to not apply it on any wounds, unless you want to feel a whole world of pain.
Oh, that's really informative. As for the last question, how do you advise the patients how to store the medication? Is it like in the fridge or in a room temperature?
Well, I wouldn't advise you to put it in the fridge. Capsaicin should be placed in a closed container at room temperature. Avoid places with heat, moisture, and direct light because that might ruin the formulation. Of course, avoid freezing the medication, and as always, make sure to keep it out of reach of children.
Okay, thank you, Dr. Farah.
Thank you.
Is that all? Bye.
Last but not least, I would like to remind the students about 3 things that you should follow. The first one is stay calm, take your medication according to your doctor's or pharmacist's advices. Be consistent and do not skip your medication. Second one, when taking your medication, please avoid in contact of your eyes, mouth, or any areas around your face. This is important to avoid irritation. The last one, please do yourself a favor by taking a break and avoid doing any vigorous activities. This could worsen your health and you must avoid it at all costs. That's all from me. Thank you and see you in your future endeavor.